Now, the country's Health Products Regulatory Authority, that's Sahpra, has been given the World Health Organization stamp of approval for its vaccine production. The WHO says Sahpra's processes are efficient to ensure the quality, safety and efficacy of various jabs. Sahpra is now ranked maturity level number 3, one below the highest ranking of 4. For more on this, we're joined now by Sahpra CEO Dr. Boitumelo Semete-Makokotlela. Thank you for joining us this afternoon, Doc, and you've got a smile on your face, which is obviously quite encouraging to know that on a global level, our institutions like Sahpra are trusted with the lives of people in the form of producing vaccines and just changing healthcare systems or contributing to in the country.
Certainly. I mean, I do have a smile on my face because it's been years of hard work and ensuring that we really are an organization that remains true to our mandate, that is compliant, that applies good governance practices, but also that the decisions that we make are based on scientific evidence. And, you know, this outcome by the WHO is really welcome because it communicates to the world that, you know, Sahpra is a well-functioning authority wherein other regulators can even rely on some of our decisions and the work we do because it complies with principles of good quality management systems, good regulatory practices, etc.
What is it that you had to do, Doc, to show organizations like the World Health Organization that Sahpra is indeed capable of producing medications like these vaccines? What was the kind of process that it is that the organization had to go through?
Sure. So what we do, and we don't produce the products, but we need to ensure that those who produce the products, they do it complying with principles of quality, safety, and efficacy. So as a regulator, what then gets assessed is how do you make your decisions? Are your decisions evidence-based? Do you have the scientific data being provided to you by the applicants? And how do you then engage with those decisions, with that data? And do you apply good scientific principles? The second thing that they look at is the life cycle management. So when a product is then available and authorized, do you apply good processes to ensure that you continuously monitor the quality of the product? So you've seen with vaccines that before they would be released, they have to go through what we call a lot release. They look at that function. The third thing that they look at is, as part of the product life cycle management, do you monitor any adverse, drug reactions, any adverse or adverse events following immunization? And once you identify those, do you have mechanisms to assess and say, is there a causality linkage to that? And then once you've done that, do you communicate with the public? And so those are all there's about 9 metrics of what it is that they look at in this process.
So it's very interesting, and I must mention that the systems here of Sahpra have been compared to those in the United States and Singapore, which is actually quite significant. Tell us a little bit about the vaccines that you look at in terms of making sure that they are best to use for citizens of the country. Is it just a focus on specific vaccines, or is it across the board?
No, so we look at all the vaccines available in the country. So a number of us will have that experience of, you know, when we were young, we had to go however often to get our jabs. Our parents always had this vaccine card to make sure that they don't miss those visits. So we look at every single vaccine, even the flu vaccines that are available. And what this process then means is that Sahpra applies good quality standards when it then reviews the vaccines that are made available in the country. And what it says then to the public is that they can have confidence in the vaccines that they're being provided to. And confidence not only in that they're quality, safe, and effective, but confidence that if anything goes wrong, there is a regulator who's able to identify that. So we use the MedSafety app. They can report to their healthcare professionals. And once someone reports something, we are then able to investigate it. And if there's any causality linkage, we then can react to that and work then with the manufacturers. And that's the confidence that the public must have. I must say that in the continent, there's only about 5 of us who have reached a maturity level 3. The others are, either lower or they're undergoing a process of review. And so even for the continent, this is great that we're starting to see an increase in regulators that have stringent processes and are comparable to our international counterparts.
That is such an important point that you raised, Doc, and I was going to bring it up with you now, the rest of the continent issue, because vaccine regulation, oversight and research has become ever more important over the last 2 years because of the coronavirus. And I'm just thinking about any collaborative efforts that you are having or would be having as regulators in the health space going forward, just to strengthen the capabilities, the stringent methods that you use and grow bigger on the global scale in terms of Africa's capability as a whole.
Certainly. Even for us as Sahpra, this is critical. There's no point in South Africa being strong on its own and then the rest of the neighboring countries are not. So we do have a Pan-African view in everything that we do. So all of us who have been benchmarked, we have identified a number of regulators that we will be doing what we call twinning with. So we work with them and we help them get to the same level of standard, probably if not even better. So in our case, we're working a lot with those in the SADC region. We've already had engagements and high-level discussions with Botswana, there's Namibia, Rwanda has reached out to us. So there's a number of countries who are saying, let's work together to make sure that at a regional level, we have those kind of centers of excellence, but that we support each other. And this is the case across all the economic regions in Africa.